It's our pleasure to introduce Dr. Kevin Stock.
Thank you all for showing up. It means a lot to me, so much that I want to make sure you get the most bang for your buck. So if it's okay with you all, I would like to do something that they discouraged me from doing, but if I get your approval, we're going to do it. And that is, I might talk a little bit fast. And if that's all right with you, we'll cover a ton and we'll dive on in. If that's all right, buckle up. So I'm sure you've probably heard those commercials. They go, 9 out of 10 dentists recommend. Well, I am the other one. I recommend something a little bit different than most dentists, but we will get to that. Today, I'm going to reveal 3 clues hiding right under your nose about what the mouth says we should or shouldn't be eating. Because the mouth holds the clues to what we should and shouldn't be eating, which makes sense. That's where food enters, it's where digestion begins, and it's often where problems first arise when we put the wrong food in it. So let's dive into our first clue. Now, if you would, imagine you're laying down at the dental office and I come wheeling up behind you and I start jabbing at your teeth with this pokey little instrument. You know what I'm doing? I'm checking to see if you have the most common disease in the world, dental cavities. Dental cavities affect up to 90% of school-aged children, and I do pediatric dentistry, and I can confirm that number seems to be fairly accurate. So cavities are caused by bacteria in your mouth fermenting a particular food, a non-essential food at that, and it ferments this non-essential food into acids, and these acids proceed to eat holes through the hardest substance in your body, tooth enamel. Perhaps that's a pretty big clue that maybe we shouldn't be eating so much of this non-essential food. So what is this non-essential food that causes bacteria to eat holes in the hardest substance in your body? It's actually carbohydrates. So proteins and fats don't cause cavities. Carbohydrates is our culprit here. Now, I'd like to add some historical context to this. If we were to take all of modern humans, Homo sapiens existence, which is roughly 300,000 years, right up there, that's the oldest Homo sapien mandible, 300,000 years. And if we were to put all 300,000 years on a 24-hour clock, what we see is for the first 23 hours, largely the fossil record shows we're free of cavities. And while we have a hard time keeping our teeth for one lifetime today, teeth preserved for millions of years in the fossil record. And for these first 23 years, our teeth were doing pretty well. But something happened just 1 hour ago at 23 hours, and that is when our teeth took a turn for the worse, and we see the rise of dental cavities. And this coincides with the agricultural revolution, the cultivation of crops, and the rise of a particular non-essential food in the diet. So, for example, in North America, we can look at carbon isotopes and we can document the rise of corn consumption and the rise of cavities. So I was recently taking this online continuing education course about nutrition and oral health, and I was curious, what are they recommending to dentists to recommend to their patients about what we should be eating for oral health? And this course was roughly broken up into 2 halves. In the first half, they were talking about the etiology of decay, basically what causes cavities. And they told us what I just told you. Bacteria in your mouth ferment carbohydrates into acids and they eat holes in your teeth. And so they talked about cariogenic foods, cavity-causing foods. These are the high carbs, the sugar, the refined grains, especially the refined simple sugars because there's more surface area for the bacteria to ferment and turn into acids. And then they went on to talk about the anti-cariogenic foods. These are the foods that don't cause cavities. And these are the ones that are low in carbohydrates and higher in protein and fats because protein and fats don't cause cavities. And so these are foods like meat and eggs and dairy and fish. And then the second part of this course went to teach nutritional counseling. And so this is the part where they were telling us what to tell patients. And they went on to recommend the healthy eating plate. Look at that plate. It's 70+% carbohydrate-based foods. And if we zoom in and look under healthy protein, a term I dislike almost as much as quote-unquote healthy fat, which we will get to in a little bit. But under healthy protein, they're telling us we want to avoid red meat and cheese. Like these recommendations directly contradict what they just told us. And I think this is one of the reasons why we have this situation today where 9 out of 10 dentists aren't recommending a low-carb diet, even though we know carbohydrates are responsible for the most common disease in the world. So although we have normalized cavities today, they're not normal. It's a sign of pathology, and it's often a sign that we're eating too much of a particular non-essential food that makes up over half of the modern diet. All right, on to clue number 2. This one has been under my nose, staring me right in the face as long as I can remember. My adult teeth started to erupt like Mother Nature has no design. And fortunately, or unfortunately, many other kids are in the same boat as me, where up to 90% of kids in industrial society have some form of crooked teeth, malocclusion. So I proceeded like a lot of kids. I got braces, I had headgear. A couple years later, I had to get my wisdom teeth out. All of this totally normal these days. And as I continue to grow, one thing I noticed was my dental arches didn't continue to grow. I have these narrow dental arches. And when I smile, you can see these black triangles in the corner of my mouth. It's called the buccal corridor. And that's where teeth should be in a broad smile. An interesting aside, my brother here, he's an ophthalmologist, but when he was a kid, he had a palatal expander. And you know what? He grew up, he had no need for braces, and he doesn't have these black triangles in the corner of his mouth. And I'm going to come back to that in a second, or a little bit. So when we look at my smile, yes, my dental arches stayed narrow and didn't grow like I hoped they would have. But what did happen was it looked like my jaws were like falling, like something wasn't supporting my jaws, like gravity was winning. And this can be seen as something known as a gummy smile when I really laugh. So I try not to do that. And when I look in the mirror, not only did my jaws have this narrow dental arches that have become long, but I see it in my face. It's mirrored in my face. I have this narrow face, this narrow, long face. And as I was growing, I was hoping to get these high cheekbones and this broad, strong jaw. But no, I got this long, narrow face instead. And now, maybe you're thinking, Kevin, this is just genetics. It's the hand you've been dealt. And then you would be just like 9 out of 10 dentists who say, this is just genetics. However, pre-industrial skulls, they didn't have malocclusion. All 32 teeth came in, and they came in straight. So if we go back to our hunter-gatherer timeline, we see something else happen just 1 minute ago at hour 23 and 59 minutes. And that coincides with the Industrial Revolution, where we start refining and milling these foods and really the birth of the modern diet. And guess what? That is with the birth of malocclusion. And so according to the research scientists and even agreement among top anthropologists, as this has happened in the evolutionary blink of an eye. Dr. Daniel Lieberman, he talks about how hunter-gatherers had no need for a dentist, no need for dentists in the Stone Age. But with the agricultural revolution, we had the rise of cavities. And then with the Industrial Revolution, we had the rise of cavities, not only cavities, but also we got malocclusion and impactions. This is echoed by Dr. Richard Klein, renowned Stanford professor of anthropology, who said he never saw an early human skull with crooked teeth. Dr. Robert Corosini, he marshaled in decades of research on occlusal anomalies, and he basically concluded this malocclusion is a disease of civilization, particularly modern foods that are causing alveolar bone deficiency, which basically means our jaws aren't growing enough. So this is what this looks like. This here is actually not me. That is a render of hunter-gatherer me with the jaws I wish I had. And this is what's happening. We'll see, I will go from hunter-gatherer to this is current me, industrial me, and this is me if we continue along this trajectory. So this is what this looks like with some stills. Hunter-gatherer me had these full jaws, a straight profile. The middle picture is current me, unfortunately. And I have both maxillary and mandibular insufficiency. And what that means is the maxilla is the top jaw, the mandible is the bottom jaw. And you can see the bottom jaw insufficiency. It's getting retrognathic. It's moving back. And then the top jaw, the maxilla, it's a little bit more subtle, but I've a deficiency in the maxilla as well, which you can kind of see by the disappearing upper lip. Perhaps that's a clue why we have such a demand for these dermal fillers today. And this is the future of me if we don't change course. Now, this isn't just science fiction. This is an example of a grandfather, a father, and a son as they've progressively transitioned to modern food. So what's causing this? Well, I would argue there's one root cause, and then there's a number of these secondary causes. And the root cause is an improper diet leading to alterations in craniofacial development. And when I say an improper diet, I mean both what we eat, but then resultantly how we eat it. And I'd like to look through this through 3 lenses: the what we eat through nutrition, and how we eat it through, and how this has changed our oral facial development. So if you're skeptical whether or not a vitamin or mineral deficiency can really do this, I urge you to consider what happened in the 1970s when expecting mothers taking the drug warfarin, they had babies with severe malocclusion. And warfarin is this anticoagulant. And the way it works is it inhibits vitamin K recycling. So essentially, this drug gives you a vitamin K deficiency. But vitamin K is just not a coagulation vitamin. It has other roles. Notably, vitamin K2 plays a very important role in craniofacial development. So essentially, these mothers were taking this drug, giving them a vitamin K deficiency, which they passed on to their babies who developed severe malocclusion. However, when we see a young girl like this, no one ever asks, could this possibly be a vitamin K2 deficiency? And one reason no one asks is, to this day, we do not have an RDA for vitamin K2. But the modern diet, you might be getting 10 to 30 micrograms of vitamin K2, when we know traditional diets were getting 300 plus micrograms, 10 times the amount of vitamin K2 than we get in the modern diet. And luckily, this girl was seen by a fantastic pediatric dentist. His name's Dr. Kevin Boyd, who treated her without surgery, and we'll get to how he got this result in just a minute. The second lens I'm going to look through this is breastfeeding or bottle feeding. Breastfeeding plays a very important role in craniofacial development. For one, it provides the ideal nutrition for the infant. And then secondly, it forces the baby to work its orofacial muscles in the proper way to stimulate that growth. Now, 1 minute ago in our evolutionary time scale, we had the birth of bottle feeding, and there was two really dire consequences of this. One is it was nutritionally inferior in many ways. And then secondly, it actually requires a different suckling mechanism by the baby, which can also hinder craniofacial development. So a number of studies show the lack of breastfeeding correlates with underdeveloped jaws and malocclusion. And the third lens I want to look through this is chewing. And this has been evaluated by Dr. C. Loring Brace, PhD anthropologist at Harvard, and many other studies that show, both human and animal studies, food consistency affects craniofacial development. And when we talk about chewing, it's kind of like if you think about working out a muscle, you want to grow a muscle, you need the nutrition, but you also need the stress. You need to go strain it in a gym to get that to grow. And growing your face is similar. And there's really kind of three components to proper chewing. One is the chewing. You got to have food that is worth chewing. The second part of that is a proper swallow. And it is a very different thing to swallow a piece of meat, for example, than swallowing baby food mush off of a spoon. These are two totally different swallowing mechanisms. Now, you can do it right now. Swallow and watch what happens. What should happen is your tongue should push against the palate. And each time it does that, 600 swallows a day, it exerts 2 pounds of force, supporting your palate, broadening your palate. Then after a proper swallow, an interesting thing happens. You are automatically put in proper oral posture. And a lack of proper oral posture is a significant contributing factor to malocclusion. So that tongue that's supposed to be on the roof of your palate, it acts as a natural orthodontic retainer. It supports the palate, and it keeps it from falling down and giving you a gummy smile, as well as it acts as a scaffolding to keep the palate in a broad U shape to make space for all the teeth to erupt where they should. So hunter-gatherers, they had 50 millimeters of width between their upper first molars. Today, you want 40 millimeters, but I'm willing to bet most people here were probably closer to 30 millimeters than 40 millimeters. So when my brother had that palatal expander ring as a kid, what happened was it made room for his tongue to be in the proper position, up against his palate, supporting the palate, keeping it broad so all those teeth can erupt where they should be, and thus he doesn't have these black triangles in the corner of his mouth like I do. Now, I did not have a palatal expander, so I had this narrow dental arch, and I have what I see every day. Narrow dental arches, vaulted palates, the mouth's hanging open, mouth breathing, and crooked teeth. But I should see this. Baby teeth should have gaps between them. It's a sign that the jaws are growing sufficiently to accommodate the incoming adult teeth. So Dr. John Mew is the pioneer of this idea of proper oral posture for the prevention and treatment of malocclusion. And this is how Dr. Kevin Boyd treated that girl I showed you earlier. But the way this works is through proper oral posture and occasionally appliances to help aid in proper oral posture. Orthotropics is what it's called, helps grow the jaws to facilitate all the teeth fitting where they should. But traditional orthodontics, it tends to be retrusive. And what I mean by that is our mouths are too small. So the teeth are just erupting wherever they can find space. And so often what we have to do is take teeth out and move everything back. That's what was done to me. And it actually shrinks your mouth even further in this situation. Now, Dr. John Mew and now his son Mike Mew have gotten so many fantastic results with this, and they call it creating beautiful faces, that it has gone mainstream. And this mewing, you'll see teens all over TikTok and social media doing this mewing to fully develop their faces. Because here, a lot of kind of beauty and health are synonymous. And one of the really important things about mewing is that it trains proper breathing. And what I mean by that is nasal breathing. You want to be breathing through your nose. Now, if you would right now, your tongue should be on your palate. Is it? Check. Okay. If it's not, put it on your palate. That's not only the roof of your mouth, though. That is also the floor of your nasal cavity. And if you have a vaulted palate, it can impede on your nose space, and it can give you a deviated septum, which, by the way, most of us here, we have deviated septums. And you need to be breathing through your nose or bad things are going to happen. For example, this kid, he was developing fantastically. And one year he got a gerbil for his birthday, and he happened to be allergic to that gerbil. So he started suffering from constant congestion. So he had to breathe through his mouth, and he proceeded to develop a retrognathic receding chin and malocclusion. And while this is just one anecdote, this has actually been studied in, I would say, some quite cruel, even jaw-dropping experiments by Dr. Eagle Harvold, who basically took these rhesus monkeys who, left to their own, will breathe with their nose, their mouth shut, and develop normal occlusion. However, Dr. Harvold plugged their nose with these silicone nasal plugs, forcing them to breathe through their mouth, and they proceeded to grow these long, narrow faces and malocclusions. So we have this situation where 9 out of 10 dentists thinks this is just genetics. However, the evidence suggests this is not just genetics. It is modern food that is altering our gene expression, and preventing us from growing our faces to their genetic potential. So clue number 3, in case you're falling asleep, I'm going to play this quick clip. Viewer discretion is advised. Okay, maybe that woke you up. So by the end of clue number 3, my goal is for you to have a good guess at what caused this accident. So when I look in the mouth, I do something 9 out of 10 dentists don't do this, but when I look in the mouth, I see this big muscle, and it's often too big for its home, like it's cramped inside. And I'll often see teeth marks on the side of it, like it's in jail, trying to break free. Well, we have this situation where we have this shrinking jail cell, but we have a growing prisoner, and the prisoner is your tongue, if you haven't caught on to this analogy yet. So we have this shrinking jail cell, this growing prisoner, and there's only 2 escape routes. One escape route is back, and you know what's back there? Your airway. So that escape route equals suffocation. The other escape route for this growing prisoner that's too big for its home is forward, and we just talked about the consequences of open mouth posture. Now, this problem is acutely evident in a sleep disordered breathing, which will be demonstrated by this man. I'm going to play this video, and I'm going to challenge you to compete with him, and I will tell you when. But right now, he is struggling to breathe. The tongue's taking the front escape route. Now, stop breathing. Hold your breath right now, and you're going to compete with this man, because what just happened is the tongue took the back escape route, and it fell back, and it is occluding his airway. So he's trying to breathe right now, but no air is being exchanged. So he's, 15 seconds without air. I don't see any blue faces out there yet. 20 plus seconds without air. During this time, all the oxygen in his blood is plummeting, and his tissues are going to start starving for oxygen, notably the brain. 30 seconds without air. Is anyone else holding there with him? All right, you can breathe now. So he just went 35 plus seconds of apnea. Apnea means without breath, and this is a very serious sleep disorder. But what happened at moment 35 was the body didn't want him to suffocate and die. So what the body did was basically pump a cocktail of stress hormones, like an adrenaline shot, to wake him up, to establish muscle tone so he could breathe and catch his breath. And this is, like I said, this is known as sleep disordered breathing. This man has a severe version of known as obstructive sleep apnea, where every night, night after night, actually hour after hour, minute after minute even, he's on a roller coaster between suffocation, stress response, suffocation, stress response. And in case of severe sleep apnea like this is happening 30, 40, 50 times every single hour of every night. He spends half of his nights awake, and he's going to spend half of his days asleep, which is a clue about what happened to that accident we saw at the beginning. So this is a scary sleep disorder. It is extremely hard on the tissues, the organs, notably the brain, and very hard on the heart, stressing the heart all night. What is terrifying is, according to the American Academy of Sleep Medicine, this affects sleep disorder breathing up to over 25% of adults in the United States. And the vast majority of them have no idea, are undiagnosed. And this will put you in the upper echelon of cardiac risk, dementia risk, all-cause mortality risk. It is scary. And it's not just adults. This is a growing problem in children who have shrinking jaws and have growing rates of overweight and obesity. And so while in adults, this manifests as excessive daytime sleepiness, low energy, low mood, low libido, low vitality, like low overall quality of life, In kids, it tends to manifest as ADHD. In fact, some sleep specialists estimate that up to 75% of kids with sleep disordered breathing or with ADHD can trace it back to sleep disordered breathing. So what's going on here? The airway is being blocked by the soft palate and the tongue, and this is made worse by what we talked about in clue number 2, a shrinking face, especially a retrognathic jaw, which will impede on the airway. And so there's a surgery to correct this. And you know what these oral surgeons do? It's called maxillomandibular advancement. Looks like it's called MMA. Looks like it's a surgery reserved for MMA fighters. But what these oral surgeons do will basically restore the face to what would be a proper craniofacial development. They're going to move your jaws forward. Now, as you can imagine, this is quite invasive. So other treatment options have been developed. For example, dentists can make an oral appliance and do oral appliance therapy. And the way this works is this oral device will be custom fit and hold the jaw in a forward position, which helps open the airway. It's kind of like if you've ever been taught CPR, they'll tell you to lift the jaw to open the airway. Same general mechanism of how this works. Now, back in dental school, I can't remember if we were taught this at all, but I somehow fell down the rabbit hole and I learned what I just told you. Basically, how serious of a sleep condition this is, how many people have it, how many people have it and don't have a treatment option, and the fact that a dentist has like this novel treatment option to help. When I graduated, I couldn't think of anything more important that I could work on. So I started a private practice exclusively dedicated to treating sleep disordered breathing. And now sleep disordered breathing ranges on this spectrum. You have mild to severe. And I always thought mild was kind of a misnomer, like a little bit of diabetes or I'm only suffocating a little bit in my sleep. And many of my patients had mild forms of sleep disordered breathing and little to no insurance coverage. So one thing led to another. I actually developed this intranasal device. This is very different than Dr. Eagle Harvold's that he used on monkeys. This nasal device actually helps facilitate nasal breathing. It's a nasal dilator, and it's combined with something known as EPAP, expiratory positive air pressure, which is basically a mechanism to help keep the airway from collapsing. So what is causing this? I've been hinting at it the whole time. You probably know, but we talked about the small mouth in clue 2, but obesity, the elephant in the mouth, we need to address that. And we have a predictive model that shows we can predict sleep disordered breathing by looking at BMI, neck circumference, and oral cavity measurements. But really what we're looking at here is 2 things, overweightness and how small the mouth is. So we need to talk about obesity. And obesity has risen from under 15% in the 60s to over 40% today. That is like in the span of one generation, a 6 foot tall male going from 165 pounds to 215 pounds, an extra 50 pounds of fat. Now, if you want an actual visual of what that looks like, I have one. So I did this in the span of 1 year, not one generation, but I went from 165 pounds to 215 pounds and back down again. I'll come back to this picture, but I want to rewind real quick because this story starts a lot earlier when I was a kid. I struggled with weight as a kid. And by the time I was in junior high, 12, 13 years old, it was already an obsession. I was doing weird diets, experimenting with macros, running every day, working out every day, doing whatever I could to figure out this problem. And by the time I was a senior, it was such an obsession. I wrote my senior thesis, a 50-plus page research paper on the obesity remedy. I've been thinking about this problem for a long time. And I proceeded after high school. I went to college. I got a degree in chemistry. I did a minor in biology. And really, it was also I can funnel the sciences through how can I use this to lose fat and build muscle. And after college, I went to dental school. And by this time, I was coaching people with body composition stuff. I wanted to practice what I preached. So I did my first physique competition when I was in dental school. A number of years later, I was at a gym and a gym friend convinced me to do another one. It's really not that fun, but so I did another one a number of years later. But I want to come back to this picture that I mentioned earlier. Over the last 25 plus years, I have studied, I've researched, trying to find the problem, and I've used myself as like a personal guinea pig and doing experiments pretty much nonstop for the last 2+ decades. And these experiments, a lot of them have been really dumb. And this one was kind of dumb. So back in dental school, I wanted to do a classic bulk. Like I wanted to put on some muscle. And so you know what I added to my baseline diet to put on the weight? And by the way, I didn't want to just put on fat. I was hoping to just like mainly put on muscle. But I put on a lot of fat. And guess what food I added to my baseline diet? Healthy fats, quote unquote healthy fats. I started eating lots of nuts, almonds, and walnuts, and quote unquote healthy vegetable oils. And guess what? I got pretty healthily fat. So I'm going to come back to these healthy fats in a minute. But if I were to rewrite 20 years later now, rewrite the obesity remedy, I've learned a good amount in the last 20 years since this draft number 1. And one is obesity is a complex topic. It is a web of endocrine and neurologic and metabolic interplay. But there's a few things that are clear. One, this isn't just genetics. It isn't that we just suddenly lost willpower in the mid-20th century, and it certainly isn't red meat. Red meat consumption over the last 50 years is down like 40% in the U.S., while obesity is up like 300-something%. All right, they're inversely correlated. So what is it? Well, if I was to rewrite the obesity remedy and if I had to do like a abbreviated answer to the question, what do we do? I would say we need to drastically reduce or eliminate sugars, refined carbs, and a special note on these healthy fats and vegetable oils. And if I'm writing it today, I'm going to have a special section on these healthy fats because I think the prevailing beliefs around what is quote unquote healthy fat is the biggest, if not one of the biggest problems with regards to obesity today. So this is the chart of what's going on with obesity. 1960, we're at 10.7% obesity rate in the United States. By the year 2030, we're projected to be at 50% obesity rates of U.S. adults. And I think based on today's numbers, I think we're around 42%. Like we are right on track. So what happened over the last 60 to 70 years? Well, we started eating more so than any other food, a lot of these novel fats, these vegetable oils, more so than any other food. While if we look at animal fats, they're flat or down during this time. And things get very interesting when we look at the last couple decades. Over the last couple decades, overall caloric consumption is flat or down. And it gets even more interesting if we tease out sugar over the last couple decades. Sugar consumption is even down over the last couple decades in the U.S., yet obesity continues to increase. The only food that is up, all other foods flat or down, one food that's up, vegetable oils. So we have this situation today where in the 1950s, obesity is relatively uncommon. In the 1960s, we declared animal fats dangerous. So in the 1970s, these healthy fats, these new vegetable oils, just skyrocket, followed by an explosion in obesity. And yet today we have the situation where animal fats are dangerous, vegetable oils are the healthy fats. So I can read your mind. I can hear what some of you are thinking right now. But Kevin, correlation isn't causation. And you're right, correlation isn't causation. I'd say what we have here is some pretty compelling correlation. A fantastic start to a hypothesis that we need to test. And fortunately, we do have tests. We have interventional studies that show when we reduce polyunsaturated fats, notably linoleic acid, the predominant omega-6 fatty acid in these vegetable oils, when we reduce these and replace them with more saturated fats, we tend to see greater fat loss. However, I will admit, we need more studies here. I'm hopeful we will. But I, for one, am not going to wait on the quote-unquote science here. For example, in 1911, Crisco, crystallized cottonseed oil, came out. And they were proclaiming it's all vegetable, it's healthy. And you know what? It took 104 years before the FDA finally pulled the plug saying, you know what? For the last century, these trans fats have been clogging your arteries and killing you. So to me, the burden of proof is really on these novel fats to prove safety, not vice versa. And we've been eating these animal fats for, according to our Homo sapien timeline, all 300,000 years. Now, to come full circle here, I'd like to turn to fellow dentist Dr. Weston A. Price, because he gives us some big hints to all three of our clues. Now, Dr. Price traveled the world at a very interesting time in the 1930s, where we had the intersection of these traditional indigenous diets and the modern diet. And he traveled the world from the tundras to the tropics, documenting the impacts of these diets. And while I highly recommend you reading this book, it's 500 plus pages, and I can summarize it pretty fast right now because he found the same thing across the entire world. Those that were eating their traditional and indigenous diets had overall healthy mouths and healthy bodies. However, clue number one, when these modern foods were first introduced to a society, they got cavities. Now, for our clue number two, the second generation post-adoption of these modern foods, they not only got cavities, they got malocclusion. And Dr. Price also gives us a hint about clue number three here. So when I'm reading this book, 500 plus pages, it's an epic. I'm turning page after page. Not once does Dr. Price mention obesity, overeating. Not once throughout the entire book. These people are eating huge amounts of sugar and flour. Shouldn't we be mentioning? He's talking all about the oral and physical degeneration of these people. Not once does he mention overweight or obesity. In fact, Dr. Price hypothesized the oral and physical degeneration accompanying these modern foods was malnutrition. He thought we basically had this calorie limit, and these modern foods were basically empty calories. And since we're filling our calorie limit with empty calories, we're not leaving enough room for nutritious food. And that's what he thought was the main problem. And this makes sense because you know what else he doesn't really mention in the book? Only in passing, these vegetable fats. They were the newest kids on the block. These vegetable oils, they made up a far smaller percentage of what he calls the displacing foods of modern commerce. These displacing foods of modern commerce were predominantly the flours and the sugars, and these vegetable fats made up a far smaller percentage. But today, these vegetable fats make up 20 to 30% of the modern diet. So 9 out of 10 dentists aren't going to do what Dr. Price did and stray out of their lane, even if a head-on car collision's coming. But I would argue all dentists need to expand their lanes here. We need to be concerned about obesity and its impact on oral health, because dentists have a front row seat to see obesity in the mouth and the dire consequences of airway obstruction. So what does our mouth say we should be eating? What do we get when we add up the clues? What diet changes led to cavities? What diet changes led to malocclusion? What diet changes led to obesity? And what were our ancestors eating that prevented cavities? What were they eating that enabled them to develop these broad dental arches where all the teeth fit in and they didn't need to get their wisdom teeth extracted? And what were our ancestors eating before obesity was a problem? Well, I would argue this ancestral diet is the polar opposite of the current modern diet. A diet where we have this situation today where being a dentist is the most secure job in the world. The demand for dentists outpaces all professions. Why? Because the mouth is the canary in the coal mine. It is the early warning system that is telling us when our diet is off. And since all of our diets are off, all of us meaning all of us eating the modern diet, the alarm's constantly ringing. Yet 9 out of 10 dentists are only trained to put out these fires. And so 9 out of 10 dentists are going to recommend elaborate oral hygiene strategies and paste and chemical rinses, and we're putting out these fires with fillings and extractions and crowns and bridges and implants and partials and prosthetics and devices. And look, I'm not against these. I told you, I developed one of these things myself. But I've always been more interested in, like, why do we need these and how can we prevent these? So I recommend something different. I recommend we take a clue from our ancestors and we limit carbohydrates, clue number 1. We limit refined grains and sugars that were leading to malocclusion with the Industrial Revolution, clue number 2. And we limit these novel omega-6 fats. And so what do we get when we limit carbohydrates and we limit these omega-6 fatty acids and we focus our nutrition around high bioavailable nutrition that requires species-appropriate suckling and chewing? Well, I'd argue you get the 1 out of 10 dentist recommending a meat-based diet. And if you focus on this and you eat like this, you will have a healthy mouth, and I'm willing to bet a healthy body follows.